Hello everyone, I am Dr. Makharan. Today our topic is blepharospasm. It's an involuntary contraction of the orbital muscle, the ocular muscles. There is the orbicularis oculi, there is some few muscles called orbicularis oculi, procerus and corrugator superciliae, sometimes the muscles around the eyes. This goes into spasm or contraction, lasts for minutes to hours. The essential problem with this blepharospasm is that this causes something called a functional blindness. That means as the patient goes on or the person goes on blinking, he won't be able to read, he won't be able to drive, or he won't be able to converse with his friends because his primary interest, or he can't do anything but to close his eyes. Normally when you speak, or if you watch me, when I speak, you can see that my eyelids are blinking. I mean, I blink every maybe in a minute 10 to 25 times per minute. That's a normal phenomenon because brain has got different function. One of the function is blinking, because when you blink, you are shifting your gaze, you are shifting your attention. It causes various processing of different different cognitive processing may have different roles. There's a big topic altogether. So instead of have the normal blink phenomenon of 10 to 25, this goes to 50, 100 or more. Finally, to such an extent that he goes on doing like this. Finally, to the extent that he has to practically open this eyes with his fingers, because his eyes are basically normal. His vision is normal, eye movements are normal, no pain, nothing, fully conscious, everything is fine. Except for that, he can't open his eyes, and this causes something called a functional blindness. Okay, so what is it cause? Practically speaking, there are basically two types. One is a reflex blepharospasm. Suppose there is some irritation to the eyes, like dry eyes, some blepharitis, some infection, inflammation, or some injury, damage. This causes spasm. This is a natural phenomenon, and that's being treated by ophthalmologists, by some lubricants, artificial tears, antibiotics, or some other medication, and probably you have to wear a sunglass when you go out, because these people are exquisitely sensitive to lights. Photophobia means photophobia. So yeah, so that's a different condition basically related to some ophthalmic pathology. The large chunk of blepharospasm is essential or primary, where there is no cause found so far. So basically people are from 40 to 60 years, mainly females, but males are all affected, and the incidence is around 10 to 20 per lakh. So there is no family history, but basically sometimes some dystonia, something might come in families also, rarely, but it's not that common. And this may be some blepharospasm, or sometimes blepharoclonus, to that the patient is it's all tight, the eyes are tightly shut. So what we have to do, or what are the investigation and how you manage, those are areas of interest. Investigations are basically, you don't do any investigation for this, because it's so obvious unless you suspect some seizures. Seizures means epilepsy like, because epilepsy is something which occurs periodically, lasts for minutes, and sometimes there will be associated altered awareness. Sometimes patient falls and get a generalized tonic-clonic fits. This doesn't occur here. This is largely confined to these bilateral areas with preserved consciousness. He is fully conscious, he can speak, he can walk, he can do anything. That doesn't occur in epilepsy. Okay. Then secondly, there are certain something called facial tics that patient goes on doing this thing, because the hands goes like where he may sniff, he may cough, he may do something. In addition to these sort of multiple motor complex tics, that particular patient can have tics involve the face. That's called a facial tics. Okay. Sometimes, very rarely, if you are deprived of sleep, sometimes there can be some twitching of the eyelids, called myokymia. Those are all normal. You don't have to treat that. You get a good sleep, that just goes away. You don't have to worry about the myokymia. Then there are certain people, or some people after taking medicine for depression, psychosis, or anxiety or something, they might develop something called a tardive dyskinesia. But those are not that rare, it's common, but it's called a tardive dyskinesia, where the person tends to do all sort of facial grimacing, twitching, protrusion of tongue and some facial movements, grimacing movements. That's called a tardive dyskinesia. Then we have something called a Meek syndrome. That's also similar to tardive dyskinesia without any cause. Meek syndrome with some grotesque faces and various sort of abnormal movements around the face. Okay. Then we have due to condition like Parkinson plus syndrome, other dystonias, other neurodegenerative disorders, head trauma. You get some sort of this sort of blepharospasm. In this video, you can see that the person is quiet, but his condition, he is having continuous tics, continuous closure of the eyes to such an extent that he is totally helpless. He can't do anything but to manually open the eyes. Otherwise, he wouldn't be able to read, walk, or even drive. So the essential treatment is, first of all, if there is any triggers, like if he is stressed or he is anxious, or if he has taken some medicine like oral contraceptives, levodopa, sometimes benzodiazepine, or some medication, if those medicines are the responsible one for this particular condition, you have to remove those drugs first. If there is any stress or anxiety, you should have a relaxation and feedback and things like that. So then thirdly, we can use so many medicine like benzodiazepine, clonazepam and other medication that may be useful initially, but sometimes this may not be useful for a longer time. In these cases, earlier people used to do some surgery called a myomectomy, removal of this some muscle called orbicularis oculi. You remove those muscles, and very rarely people used to do the nerve damage, because the facial nerve is being innervated by a nerve called seventh nerve. Okay, that nerve is being cut, but the effect is that you get a facial weakness. Now it's not done now. Okay, now the 95 or even 100% of the neurologist or consultant, they do something called a botulinum toxin injection. In that case, there are various brands there. You have Botox there, Dysport is there, Xeomin is there, BTX is there, and many new brands are there. Botulinum A, B, C, D, like that, and many subtypes are there. So we take maybe 25 to 50 units of botulinum toxin injection, and we give this injection to the muscles in and around the eyes, especially the procerus, the corrugator superciliae, the medial and upper part of the orbicularis oculi, the lateral lower part of the lid, and sparing the medial part, and sometimes to the upper eyelids also, maybe 2.5 units per side, 4 to 8 sites per eye. Okay, so usually the effect lasts for 3 to 6 months, and the effect is after maybe within 2 to 7 days the drug gets its effect, and patient will be able to open his eyes and read normally, walk normally, drive normally. But the problem is that you have to take this medicine maybe once in 4 months, once in 6 months, otherwise this will recur. So probably my suggestion would be take a small dose of drugs like clonazepam, and in addition try to get injected every 4 to 6 months, so that would give a lasting relief, and this has to be continued for many years, but there is no other cure. The MRI is normal here, every investigation would be normal, except that if you do a functional MRI, that shows some abnormality in the basal ganglia. There are certain nuclei in the brain, inside the brain, that causes some abnormal processing in that basal ganglia, causes this is some sort of a dystonia, that means abnormal contractions causing a sustained contraction of the muscles. The dystonia may be in the hands, it may be in the neck, it may be in the eyes, it may be in the face, anywhere. It can occur anywhere. It can be the limbs, can be one half or both sides, can be the tongue, it can be the jaws, it can be any muscle can get affected. In this case, the eye muscles are getting affected. That's actually a form of a focal dystonia. Okay, so we have to find out whether there is a focal dystonia like a blepharospasm, whether it's part of an epilepsy, whether it is it's a part of a facial tics, whether it's a part of a myokymia, whether it's part of a Meek syndrome or a tardive dystonia, whether it is caused by head trauma, infection, encephalitis, Parkinson's, multiple sclerosis, or some drug induced. So we have to find out if there is a correctable factor, we have to remove those correctable factors, and if there is stress or if there is a reflex blepharospasm, should consult a ophthalmologist and find out and get his opinion, and maybe have to use all those things which are needed for the eyes, like eye drops, as well as using a dark glasses. And if basically a primary essential blepharospasm, the treatment would be injecting to the muscles which are hyperactive, like this orbicularis oculi and the muscle in and around the eye, sometimes even the upper part of the face. Okay, so today I would like to stop here. This I just want to tell you, this is a common condition. This can be eminently treatable, and people will have a lasting relief with frequent consultation, maybe frequent injection, and is largely treatable. So with these few words, let me finish. Thank you very much. Bye.